So with all of that out of the way, just some background. The Washington Cares Fund is a new program that gives employees access to long-term care coverage. You'll hear and learn about the latest updates on the state's long-term care insurance program today. We'll cover who contributes to the fund, who can get an exemption, how workers will meet contribution requirements, and more. So we're about to start our program by hearing from our special guest speaker, Rachel Smith, President and CEO of the Seattle Metro Chamber, on the importance and impact of Washington Cares. She'll be followed by ESD and DSHS experts, Allison and Ben, to learn how to fulfill the employer role in the program and how to answer questions from your employees. And then, as I said, I'll move to Q&A at the end of the program. So remember to drop your questions in that Q&A box. So Rachel, I'll ask you to turn on your camera. Welcome, and thanks for joining us.
Hello, everyone, and good afternoon. Just 9 minutes. I'm so glad that all of you have joined us for this important event today. I'm just going to set the stage very briefly before handing this over to our experts, which I am not. I think, as everybody knows, the long-term care legislation passed in 2019. And because this legislation impacts businesses, it mattered a great deal to us as a chamber. And when I was asked to apply to serve on the Long-Term Services and Supports Trust Commission that oversees the program, it was a resounding yes from me. And I think I can speak for everyone when I can say, it's been a journey. When first contemplated, there was business interest in this. We absolutely want to ensure that people can stay in the workforce or get back into the workforce. That is particularly true for women who are often caregivers and other people who have a lot of value still to add to the workforce. I think it's also fair to say, though, that like many business policy shifts, the journey has been a bit bumpy at times. There were questions around timing and scope and solvency and legal action. But with all of that now behind us and sort of fast forwarding to where we are today, I have remained really laser-like focused on the nuts and bolts, the tools and resources of how employers will be able to administer this program to employees. Like paid family and medical leave, your organization is the facilitator between the employee and the benefit. You all want to know how to talk to employees about the program and how to help employees understand the differences on their paychecks when deductions begin on July 1st. So I think whether you're feeling some trepidation or excitement about this change, we all need to be really ready for the program implementation. As your advocate on the commission, I have been meeting behind the scenes, as Ben and Kristen both know, with the WA Cares team. I really thank them for their partnership. And we've done a real deep dive into the business outreach and sort of tactical needs. I think the WA Cares team really understands how large the task is to ensure that all 200 and nearly 62,000 business owners and managers in Washington State have and are able to use the tools that they need before the payroll deductions begins, from things like pay stub inserts to an employee deductions calculator. I think we really know how important this is to your operations and to maintaining really great relationships with your employees, who I know for many people are truly like family. And I hope you brought your questions today, and we'll walk away from today's webinar with real tools and clear answers from our expert panelists. So thank you so much for the opportunity to say a few words before we get into the meat of the matter. And Lee, I'll turn it back over to you.
Wonderful. Thank you, Rachel. I will in turn hand it over to Ben for getting into the nitty-gritty.
Thank you so much. And thank you, Rachel, for your work on the commission. You have really played a key role in giving us feedback from the employer perspective that has helped us fine-tune the program to make it work better for employers and employees. So thank you. Well, let's start by defining what we're talking about when we say long-term care or caregiving. Long-term care is help with activities of daily living like bathing, eating, dressing, preparing meals, grocery shopping, and more. It does not include medical care, like doctor's visits or treatment for medical conditions. Long-term care covers a broad spectrum of needs and circumstances, including for younger people who have been unexpectedly injured or disabled or ill. A lot of people don't realize what a broad range of services can be included when we talk about long-term care, we often think of it as care in a residential setting like a nursing home or assisted living. But actually, the vast majority of people on Medicaid, LTSS currently, Medicaid long-term care, get care in their own home. And our surveys of Washingtonians find that the vast majority of Washingtonians plan to use their Walk Cares benefits in their own home and not in nursing homes. So I think that's important to reset people's understanding of the issue. Most people don't need to go to a nursing home except for maybe the last month or two of their care trajectory. It's also very common for family caregivers to not realize they are a caregiver. Almost every business in the state has at least one employee who is involved in caring for a loved one, an older adult, a mother or father, a spouse's mother or father, etc. You might go to your mom's house a couple times a week to cook meals, drive her to appointments, make sure she's taking her meds. These are all common things that we do and employees do. In fact, the majority of this type of care is provided on an informal basis, unpaid care from a family member, friend, or neighbor. And this is one of the reasons why Walk Cares was enacted, to relieve this choice that a lot of us are faced with, where we have to choose between being able to work and being productive at work, or having to to quit our job to care for our mom or dad or another loved one in our family. Next slide. So here's how Walk Cares will help this situation. It's a universal long-term care program. It's an earned benefit. You contribute for a certain number of years to qualify for benefits. It's self-funded from workers' contributions, which go to a dedicated trust fund that can only be used for this purpose. Almost all workers will contribute. Some workers are automatically not covered. Federal employees are not included. Tribal business employees are only included if their tribe has opted in. And self-employed people can choose to opt in, but they're not covered automatically. Other groups of workers may be eligible to apply for an exemption, and my colleague from the Employment Security Department, Allison Eldridge, will talk about that more in a moment. Workers contribute 0.58% of every paycheck to Walk Cares, a little over 0.5% of each paycheck. You can see here what that looks like for the typical worker who makes just over $50,000 a year. That's the median covered worker makes about $50,000 a year, and would contribute $291 each year, or about $24 a month. Workers only contribute while they're working. Here's a big difference between Walk Cares and private long-term care insurance. Contributions stop when you retire, or if you become unemployed, or simply are not working to raise a child, for example. So you only pay while you're working. Everyone is covered at the same rate, regardless of whether or not they have any pre-existing conditions. And when it comes time for a plan member to claim benefits, there are no copays, no deductibles, no need to file a claim. Our staff connects people. We'll have a portal where people can apply online, manage their benefits online, find providers, and then the provider bills the state. So the people claiming won't have to deal with paperwork. Contributions to the program begin in July of 2023, and benefits become available in July of 2026. Next slide. So this is what contributions look like over the course of a career. The middle column is the typical Washington worker who will pay about, over a 30-year career, pay about $8,700 into Walk Cares for a benefit that is $36,500 now and will go up over time with inflation. Everyone contributing to the Walk Cares Fund earns annual credits towards benefits. To earn a year, you have to work at least 500 hours in that year. Part-time and temporary workers contribute to Walk Cares and can earn benefits as well. By contributing for a certain number of years, you qualify for the $36,500 benefit. There are 3 pathways to meeting this contribution requirement. Early access is for workers who have not yet earned lifetime access, which is the middle column, but have a care need while working or soon after leaving work. So if you, for example, let's say it's 2029 or 2030, and I, God forbid, were to have a skiing accident or a car accident and needed long-term care for a period of time, I would be eligible as long as I paid in 3 out of the last 6 years. So by 2030, I would have paid in 3 years and I would be eligible for full benefits then. Lifetime access is for workers who contribute 10 years without a break of 5 or more years. So most people over time will qualify through this middle pathway. That's the way Social Security and Medicare work as well. You pay in 10 years over your career, and then you're qualified. And then there's the fast track, which the legislature created a 1.5 years ago for near retirees. So for people who were born before 1968, so roughly people who are 55 or older today, they may not be able to meet the 10 years. And so for them, the legislature created a special pathway, which is a prorated pathway. So for every year they pay in, they earn 10% of the full lifetime benefit amount. So if I pay in 3 years and then retire, I will be eligible for 30% of the lifetime benefit. So that's around $10,000 or $11,000. And that again will go up with inflation. Another example, you could work just 1 year after enactment and you would still be eligible for a benefit. You might pay in $300 and be eligible for $3,650 worth of benefits. Near retirees will have permanent access to whatever percentage of the benefit amount they earn at the time they need care. And if they end up working after retirement from their current job and they do odd jobs in retirement, they could increase their number of years paid in and ultimately get to the 10 years as well. Next slide. The benefit is flexible. Once workers meet the contribution requirements and need help with at least 3 activities of daily living, which is basically a synonym for saying if they need long-term care, if they can't live independently, they get access to $36,500, which they can use flexibly on any of the things here on the slide. You can pay a family member you can make a loved one a paid caregiver. So if your spouse or daughter or son is taking care of you, you can actually pay them to do that to help the family pay its bills during a difficult time. Or if you prefer to have a professional caregiver come in, you can do that. You can have meals delivered, get transportation to appointments, etc. You can also use it in a facility for care in an assisted living facility or a nursing home if you so desire. Next slide. We get asked a lot about how far the benefit will go, what it will cover. So it's important to remember the vast majority, the vast majority of people don't need care for a long period of time. Long-term care is typically something that happens at the end of life. It's a very vulnerable time, but it's usually not a long period of time. About a third of people need care for less than a year, and for them, it could cover all of their needs. For the middle third of people, they need care for 1 to 3 years, and it would cover part of their need and then give them an opportunity and time to plan for the rest of their need. And then about a third of people end up needing long-term care for 5 or more years. And for those people, this will just be a starting point to helping them with their care journey, but they might end up ultimately having to pay out of savings and then go on Medicaid. On the slide, you see some examples of the types of things you can pay for with the benefit. You could focus your benefits on paying a family caregiver and getting care supplies. You could use it for home accessibility. You could use it for temporary supports and services, to stretch your benefit over a longer period of time, for example. There's a lot of different ways you can use it. We basically give beneficiaries a budget. They can spend the money as they see fit, as long as it's for long-term care purposes. And with that, I'll pass it to my colleague from the Employment Security Department, Allison Eldridge.
Thank you. Okay, so I'm going to talk a little bit about the employer role and responsibilities related to law cares. So employers don't contribute to the fund, but their responsibilities include maintaining records of their employees' exemptions, collecting premiums from employees beginning July 1st, and reporting employee hours and wages and remitting premiums to Employment Security Department each quarter. The definitions of employer-employee remuneration are all consistent with paid family and medical leave. And the definition of wages is also consistent, but the premium is not charged above the Social Security cap. So that is one aspect that's a little different. Slide. So employee exemptions, there's a number of different categories of folks who may be able to apply for an exemption from contributing to WellCares Fund. The first category is private insurance exemptions. They were available for people who had private long-term care insurance before November 1st, 2021. And the application period for that was October 1st, 2021 through December 31st, 2022. So we are no longer accepting applications for that type of exemption, but anyone who was approved for one of those exemptions is still permanently exempt, and their approval letter should still be used as proof of that. Next slide. So there were new exemption pathways that were added to the program as of January 1st, 2023. So just this past January, we had applications available for veterans with a 70% or greater service-connected disability, non-immigrant visa holders, spouses and registered domestic partners of active duty service members, and out-of-state residents. The service-connected disability exemption is permanent, like the original long-term care insurance exemptions. The other three are what we would call conditional. So as long as someone continues to meet the conditions of that exemption, they would still be approved for it once they're approved. We have the applications available online. They do each require a different type of documentation to substantiate meeting the conditions of the exemption. So the list of documentation and the requirements is available on the website. Folks would need to create an account, which they would do through Secure Access Washington. And the instructions for doing that are also available on the website. We want to call out that because premium withholding begins July 1st, we are committing to process all of the exemptions that we get up into June 1st, so that those folks can get their approval letters into their employers before premium withholding begins. But if we receive an exemption application from an employee after June 1st, we may not be able to approve it and have it be in effect before premium withholding begins. Next slide. So it is an individual employee's responsibility to apply for the exemption, and if they're approved, to give a copy of their approval letter to their current and all future employers. Once an employer is notified that an employee is exempt and receives a copy of that approval letter, the employer needs to keep a copy of the letter on file, and they must not deduct WellCare's premiums from that exempt employee. Employees are not entitled to a refund of premiums withheld before their approved exemption was effective. And you'll see in the sample letter, there is an effective start date in the approval letter. So you'll be able to tell when the exemption is in effect. And so any premiums that are withheld prior to their effective date or prior to them giving their approval letter to their employer, they're not entitled to a refund. Next slide. So as I said, premium withholding begins July 1st. The premium is 0.58% of an employee's gross wages. We do have a premium calculator available on the website. So you can go there to calculate premium. The next slide. Quarterly reporting for WellCares will begin in October. So premium withholding is July 1st and quarterly reporting begins October 1st. It is a combined wage report with paid family and medical leave. So for employers who are already reporting for paid leave, it is the same employer account, same report that you would use to include the your WellCares report. Reporting requirements in general are to have the UBI number for the business name, total paid leave premiums collected, total WellCares premiums collected, and then for each individual employee, their SSN or ITIN, first and last name, middle initial is optional, their WellCares exemption status, and their wages paid and the associated hours worked for the quarter. We do have some proposed rule changes that will add the employee's date of birth to the wage report and to begin requiring a report even in quarters when an employer had no payroll. We expect those to be effective July 1st, but they are still in rulemaking right now. And if folks are interested in the rulemaking information or the draft rules, I can provide a link to where you can find that information. The next slide. So the filing methods, as I said, it's combined with the paid family and medical leave report. So you would have the same options for the quarterly report that currently exists for paid leave. You can manually report employees up to 50. And then if you have more than 50, you would be able to do a CSV file upload. We do have a template available online with the rule changes for the reporting requirements. We will be updating the template that will be available. We should have it posted within the next week or two. And we'll have updated file specifications that go with it. The next slide. So while the report itself is one shared report for paid leave in Block Cares Fund, the payments do need to be separate. They're different trust funds. And so it's all part of one flow within our system. So you'll go through and file the report. And once it processes and the balance is due, those amounts will be split out and you'll have to make the payment separately. The payment options are check or money order, ACH, or credit card. And we also have the bulk filing options for third-party administrators, so they can file with an ISESA. They can do the wage report with an ISESA file, and they also have bulk payment options. Next slide. So we do know that there is a lot more information that employers need to know about the very nuts and bolts things related to reporting and paying, elective coverage, all the different topics. So we are going to have a series of webinars that ESD is hosting. We have, this is the overview schedule. Some of the dates have been solidified and some are just in the works, but we will have information about each webinar and details about the topics that we'll cover and the link to registration details in our employer newsletter. And we'll provide a link for you to be able to sign up for that listserv and make sure that you're getting those updates as well. You, Ben.
Next, thank you, Allison. We know you're getting a lot of questions from employees about WA Cares. We want to make sure that you have the resources you need to answer them. Here's an overview of some resources that are available in our employer toolkit at wacaresfund.wa.gov/toolkit. Again, wacaresfund.wa.gov/toolkit. These materials are designed for employers and other organizations who want to communicate about WA Cares. Many of these materials are available in multiple languages if you have large numbers of employees whose primary language is not English. Next slide. First, we have a calendar with major milestones and recommendations that makes it easy for you to communicate with employees about the program. It gives you a template for when and how to deploy all of the toolkit materials to ensure your employees are well informed. The toolkit also includes a paycheck insert that you can use either electronically or place in printed pay stubs. It also includes an FAQ document that covers a wide range of questions you may be getting from your employees. We'll continue updating this document as we hear about new questions that are coming up from workers around the state and from employers. And we provide monthly long form content designed to be usable in all staff emails, mailing list updates, or intranet posts. The content for each month is tailored to what employees need to know at that particular point in time. Overall, we hope that if you share these resources with your employees, you'll end up getting fewer questions and the program will be easier for you to roll out. Next slide. We provide a few other materials like social media content that are primarily designed for community organizations, but this material also includes simple graphics you may find useful for including in employee newsletters or other materials. Next slide. We have a fact sheet and poster available in English plus 15 other languages. We recommend putting the poster up in your break room, including the fact sheet and employee benefit packets. We also have an infographic with a visual overview of the program. Next slide. We have a wide range of video content available, including animated explainer videos, program overview videos, and recordings of past webinars and program basics. We are also working on a series of FAQ videos that we hope to publish soon, covering program basics like who contributes and how to use benefits. Next slide. You can sign up for our mailing list to be notified when new materials like those FAQ videos become available, and to receive other program news and updates on webinars. And the Employment Security Department has a fantastic employer newsletter that provides monthly updates on WACARES, along with info on other programs like paid leave and unemployment insurance. You can find links to subscribe on the toolkit page. Next slide. We encourage you to reach out using the contact information on this slide if you still have questions. Here's that toolkit link again if you'd like to take a look at the resources we discussed and use them to educate your employees. And we encourage you to follow us on social media, where we also share regular updates about the program. Thank you.
Okay, thank you so much, Ben and Allison. We are going to move to audience questions. So I will start with just kind of a question about the program that I might have missed, but I don't think I heard. Can you share about the portability of this fund to an employee who might want to use it?
Sure. So we have an oversight body called the LTSS Trust Commission, and over the last few years, every year they've made recommendations on ways to improve the program. For example, they recommended having the prorated benefits for near retirees. They recommended having exemptions for out-of-state workers and so forth. And over time, those recommendations have almost all been adopted by the legislature. Last year, they recommended making benefits portable so that if you leave the state after you start contributing, that you'll be able to claim benefits in other states. The legislature did not open the statute this year, so that was not considered in the 2023 legislative session. But they may take it up next year. Obviously, we can't predict what the legislature will do, but in the past, they've taken those recommendations very seriously. And so it's certainly something that the commission is very focused on. And I know that it's something that the legislature is aware of, is something that needs to be worked on, but I can't predict what they'll do.
Okay, so at this time, it's not portable.
At this time, it's not portable.
Okay. So kind of a related question. If someone applied for an exemption and received it in 2021, and there are changes to the program, such as portability in the future, that might make them want to be a part of the program, I know you said exemptions are permanent, but can you unexempt yourself?
You can't do that now, but one of the recommendations that the commission made last year was to allow people, for precisely what you're talking about, to be able to rescind their exemption. That was a recommendation they made. Again, the legislature didn't open the statute this year, but they may consider that next year. It's kind of low-hanging fruit, really, to allow people to participate if they want to, but the legislature would have to enact that change.
Okay, thank you. So keep posted for updates on some of these items. So I'm going to move into some audience questions. I saw that you on one of the slides showed that there was a calculator for employees to be able to understand what they're putting in and their benefit. So I imagine we'll share that out after the event. Let's see here. A specific question, you mentioned some folks that are exempted already, but what about asylum seekers who are still being processed? Do you know anything there? But who might be working in Washington?
I think that's a question for Allison.
I was just checking, so I know there's a number of scenarios that we try to be inclusive of in our policy. So I think for an individual in that circumstance, the easiest thing would be for them to call our customer care team, and we could talk through with them the options for the exemption.
Thank you. And can we share that number for the customer care team in the chat? So yeah, we'll answer some of these more general questions, but if you have a really specific scenario, I think it sounds better to just call. So let's see. it was mentioned that out-of-state employees are exempt from this withholding. So for an employer, does that mean that all of their employees that live in another state need to apply and receive an exemption from Washington?
Yes, if they are living in another state and working in Washington, they would need to apply for the exemption.
Okay. Maybe I'm getting too in the weeds, but what if the company is based in Washington, but the person is a remote worker in another state? Is that the same scenario?
Yeah, there's it generally, but there are some. It depends on where their work is localized, and for individual employees that could be different. And so that's probably another scenario where folks with questions would want to call the customer care team and get more information that's specific to their circumstance.
Okay, thank you. Can employers request, I'm assuming maybe this person means like physical copies of those flyers from the info page, or is it something they would need to print themselves?
I mean, you could request it. We'd be happy to send them out if you'd like to request them. We'd be happy to send them out.
Okay, and we'll again share all the links out after the event. So watch for that email from Shoshana. Do you know if all of the quarterly reporting can be done via payroll, such as a program like ADP?
Yes. Third-party administrators, also called employer agents, payroll companies, they will be able to, it's all integrated with paid family and medical leave. And so ADP and the like will be able to do the reporting and payment.
Great. Going back to the materials, it seems like you guys have put together a really great slate of things for employers to share if employees have questions, but are any of those required to be provided to employees? To meet any sort of like reporting requirements or?
No, not, no.
Okay, thank you. If you pass away, what happens to your contributions?
It stays in the fund. It's an insurance program, kind of like if you buy, car insurance or life insurance, and you pass away, you don't get your family doesn't get the money back. It's an insurance. If this were an individual account, that would work that way. But if for an individual account, people would have to save probably 2 or 3 times as much as what they contribute. The reason why premiums are lower in an insurance program than if you were to save individually is because precisely that not everyone uses it. So it makes it more affordable. If everyone had to save the $36,500 themselves, they'd have to save, the average worker is only paying $8,700. That's one for a $36,000 benefit. And that's one of the reasons why it's a good deal, because it's insurance and not an individual account.
Great, thank you. Sorry, I'm kind of bouncing all around in the questions. I'm trying to hit some highlights. If you're using the benefit to pay a family caregiver, do they have to be certified in any way to qualify for that? Oh, Ben, we've lost your audio. We can wait for him to come back on. Allison, let's see if I can snag a question for you.
Hear me now?
Oh, yes. Yep.
Yeah, sorry, my Zoom crashed temporarily for some reason.
Oh, no.
So the question, what was the question again? Sorry.
If you're using the benefit to pay a family caregiver, do they need to be certified?
Yes, they do. They do, because there are certain legal requirements about just making sure that people don't get harmed by someone not knowing what they're doing. But they're low. They're not high requirements, and the state walks you through that. You can do training online, and it's certain hours depending on your relation to the person. It's more or less hours. For spouses or children. It's not a high bar, and it's free training. So.
Oh, great. Okay. If your payroll company is out of state, how do you make sure they get and understand this information?
Yeah. So as Employment Security Department, we work with employers and payroll companies all over the country. And so there are associations for payroll providers, the National NPRC, National Payroll something Consortium. We work through them to be able to get the information out to all of their members, no matter where they are in the country. And they share with other like organizations.
Okay. Is there a cap on how much can be deducted from an employee annually or in a lifetime?
No. It works like Medicare in that regard, where you pay, it's different from paid leave in that paid leave is insuring your wages. It's wage insurance, kind of like unemployment insurance. You're insuring wages up to a point. This isn't insuring wages, it's providing a service benefit like Medicare provides healthcare. So it works more like Medicare, where you pay in a percentage, but everyone gets the same benefit.
Great. I see a couple of questions here. If you are a business owner or an LLC, are you subject to this or exempted?
It often depends on the business structure. So we do have information. Actually, I can't speak to whether it's posted online yet or will be soon. Elective coverage for Black Heirs Fund begins July 1st. And so we do have information about electing coverage if you are considered self-employed, the differences between, what counts as self-employment versus not. And so all of that will be available on the website very soon. And you can always call our customer care team with questions.
Okay. Thank you. And then another question about a franchise. So again, I think call the number if you have a specific question about your business. So the program starts July 1st. From a practical standpoint, is it okay to withhold for the first payday in July, or do they need to separate out wages paid? Like if the pay period crosses the month, I guess, do they need to separate those wages out from June? How
it's wages
work?
It's wages paid and associated hours worked. So it would just be for the wages paid and then the hours that are associated with those wages.
For July only. Let's see here. If an out-of-state employee moved to Washington, can they apply for an exemption at that time if they have a private policy of their own?
No.
Okay.
If they're out of state, they work for a Washington employer, they could apply for the exemption for living out of state. If they move to Washington, they would need to discontinue that exemption within 90 days of their situation changing. And there wouldn't be, unless they qualify for one of the other available exemption pathways, the service-connected disability, temporary work visa for temporary visa for non-immigrant workers in
Military
south of the
spouses.
military. Yeah. That would be the only available option.
Yeah, but essentially, to at a higher level, the idea is that people who had exemptions prior to implementation of the program were able to get an exemption based on having private insurance. The intention of the private insurance exemption was for people who already had private insurance before the law was passed, and they gave people an extra year or two after that. But it's just for people who had that already. But it's not. They didn't want to create an incentive for people to buy private insurance to opt out. It was for people who had it prior. So that window is closed.
Okay, thank you. So this person has some employees who live in Oregon, so would be exempt, but are not proficient in English and don't have computer access. So I think there are a couple of questions here. One is that customer care line something that can support folks in other languages?
Yes.
Is there a way to apply that's not on the computer, et cetera? And then she has some other questions that I'll get into next.
Yeah, So we do have some other options for folks who are unable to apply online. We have a paper application that we can get to them. And I believe there are circumstances in which we will take some information over the phone. The difficulty is that because of the documentation kinds of requirements to substantiate the condition that makes you exempt, it's a little, we can't do the whole thing over the phone. So, but they could call, and we do have a number of specialists who speak Spanish, and then we have a interpreter service and can make sure to provide customer service in any number of languages.
Great. So what would be the best way for the employer to support her team in that process? Is there anything that she can do proactively beyond just like sharing the number with them? How involved could she be in the process, I guess, is the question.
Yeah, so certainly you can share the information. If you were to call, we could get, I know that we have a kind of employer packet that is more tailored to some of the non-immigrant work visa types, because it's a little bit different level of support for agricultural workers and things like that. But we do have things like that, and we're happy to accommodate and create other materials that would be helpful when we know what they are. And so we would be, if you call, we'd be happy to kind of put something together to support you and supporting your employees.
Thank you. Is it up to the employer to tell the out-of-state employees that they need to apply for this and make sure that they're aware of this program, or is that done through other means through you guys?
So we are making the information as widely available as we can. And the, kind of reality is there is no mailing list of all people who work in Washington and don't live in Washington. So we do rely on employers to communicate the information to their employees when they have it and they think it might be relevant to them. Again, we're happy to provide additional materials to give to employees, but the responsibility really is on the individual to apply for the exemption and then to provide that approval letter once they're approved to their employer. So there is no hard and fast responsibility related to employers to deliver the information.
Thank you.
And if I could just add to that, one of the reasons for that is the legislature didn't want to create a burden on employers to have to administer this program. It's employers are not administering this program. The state is administering it. If we had required employers to administer exemptions, then every employer in the state would have to become an expert in this and administer exemptions and be liable if they did it wrong. And that's just, I think the legislature and the commission didn't want to put that burden on employers. So I think that's one of the reasons why it's an individual responsibility. But, employers can certainly help their employees, as Allison was saying, and give them information. And we hope that they do so.
Thank you. Excuse me. So if you're applying for an exemption, I think you might have said this, but can you remind us, is there a deadline for that if you are in one of those qualifying groups?
So there's no deadline to apply, as in, unlike the private insurance exemptions that were only available for a defined period of time, these additional exemption categories are ongoing. So there is no hard and fast deadline. If someone would qualify for one of those and plans to apply and wants to have their application approved prior to premium withholding beginning July 1st, we would encourage them to get the application into us by June 1st.
Okay, thank you. And if someone had a event later that switched them into one of those categories, they could apply at that time. Thank you. All right. I think that is most of the kind of different types of questions that we got here. Okay, oh, here's the different one, sorry. What if employees work for a Washington-based employer but do all of their work in another state?
That would again be a question of localization.
Okay.
Generally, if an employee is considered localized for paid leave currently, they're probably going to be the same sort of status for law cares, but you could call our customer care team to get specific.
Okay, thank you. And I do have several questions here, and I believe you've said it, but I just want to clarify that at this time, there is not an opportunity to apply for a private insurance exemption. There could be in the future if the legislator decided to move that way, but not at this time.
That's right. And it's very unlikely that they would do that because they'd have to repeal the program to do that, really.
Got it. Okay. So there were several lingering questions on that front. And the last one that seems a little different, is there any sort of cap for high income earners paying in? Okay. Great. Well, I have a couple of closing remarks and notes, but Allison and Ben, I'll open it up to you just for any last thoughts, anything that you thought would come up in Q&A and didn't that you want to mention. The floor is yours.
I don't have any. Thank you.
I would just say that we're happy to come out and give presentations at a specific company or any other industry association gathering that you think would be helpful. If there's conferences that you go to in your industry or just for your own employees, we're happy to do this. So just let us know if you'd like us to do that. We want to get you the information that you need to have a successful rollout and get people's questions answered. So please do let us know if we can be helpful in any way.
Great. Well, thank you both so much for your time today and all of that information. Again, for everyone who's on the webinar, we will be sharing the recording out after the event and links to those resources that Allison and Ben mentioned. So watch for an email from Shoshana with that as early as tomorrow, but likely into early next week. So thanks for joining us today. We have all of those links. And we have lots of chamber programs all the time. If you're here today and this is your first chamber event, we would love to see you at another one in the future. There's some web addresses here on the screen where you can find out more about chamber membership. And maybe you're not sure you're a member or not, you can always contact our membership team and they'll be happy to talk through that with you. And it does look like Shoshana just dropped some links and information in the chat. So yeah, we appreciate your time. It was lovely to see all of you today and have a great afternoon.